All right, today we're going to talk about a device you've probably seen 100 times in movies and TV shows, but maybe never really thought about, the syringe pump. I mean, it looks pretty simple, right? Just a box that pushes a syringe. But trust me, what's going on inside is an incredible piece of engineering that solves a very real life-or-death problem. So let's just jump right in with a question. Imagine a patient needs an extremely powerful drug, but they can't get it all at once. They need it delivered in a tiny, continuous, and absolutely perfect dose. We're talking about delivering a single drop of liquid over the course of an entire hour. How on earth do you even do that? Well, the answer to that really tricky problem is exactly what we're here to talk about. It's the syringe pump. This device is the purpose-built, engineered solution to this challenge of extreme life-saving precision. So what is this thing really? Well, at its heart, it's an electromechanical device. Just think of it like this. You've got the electro part, the brains, the electronics, and the mechanical part, the muscle that does the actual work. Its one and only job is to push the plunger of a syringe forward at an unbelievably slow and controlled speed. It's all about turning digital commands into perfectly smooth physical motion. And believe me, this level of precision isn't just a luxury. These pumps are absolutely critical in the most high-stakes places in any hospital. We're talking ICUs, operating theaters, and especially in neonatal units, where you're dealing with the tiniest, most fragile patients. In these environments, perfect accuracy is the difference between medicine and poison. Okay, so how does it actually pull this off? Let's follow the journey. Right from the electrical outlet on the wall all the way to the medicine flowing into the patient. It's actually a really cool story of energy being transformed from one form to another. It really boils down to these 4 key steps. First, you've got your basic electrical power. The pump's computer turns that into a super precise digital control signal. That signal then tells a motor exactly how much to turn, creating rotational motion. And here's the clever part. A special mechanism takes that rotation and converts it into perfectly straight, linear motion, the slow, steady push that moves the plunger. To really get it, it helps to think of the system in 2 parts. You've got the brains of the operation, and then you've got the brawn that does all the heavy lifting. And this division of labor is what makes it all work. On one side, you have the brain. That's the microcontroller. It's doing all the math, calculating the speeds, watching the safety sensors, and sounding the alarm if anything goes wrong. Then you've got the brawn, the motor, and the actuator. Their job is simple. Just execute the commands from the brain with perfect physical precision. Let's take a closer look at the brain's to-do list, because it's pretty busy. A doctor or nurse tells it, I need 1 milliliter per hour. The microcontroller crunches the numbers and figures out the exact speed the motor needs to turn to make that happen. But it's not a set it and forget it kind of thing. Oh no. It is constantly checking all the sensors to make sure everything is running exactly according to plan. So how does the brawn get that perfect motion? This is the secret weapon. It uses a special kind of motor called a stepper motor, which moves in tiny, precise, repeatable steps instead of just spinning freely. That motor turns something called a lead screw, basically a very, very finely threaded rod. With each tiny step the motor turns, the screw pushes a block forward a microscopic distance. It's this beautiful, simple system that turns rotation into that flawless, slow, linear push. Now, being able to deliver drugs this precisely is incredible, but it's also a little scary, right? I mean, what happens if something goes wrong? Well, that's where the pump's built-in safety net comes into play. Seriously, this is the question that keeps biomedical engineers up at night. What if the patient's IV line gets kinked? What if the syringe is almost empty? What if someone accidentally puts in the wrong size syringe? In this line of work, failure is just not an option. The solution is to give the pump its own set of senses. It is packed with sensors that are always on the lookout. There's a pressure sensor that can literally feel if the line is blocked. There are sensors that know if the right syringe is loaded or if the plunger is getting close to the end. And if any of these sensors spots a problem, the brain immediately slams on the brakes, stops the infusion, and sounds an alarm to get help. Okay, so let's pull back for a second and look at the big picture. We've seen how it works. We've seen how it keeps patients safe. Now let's talk about its role as a truly critical tool in modern medicine. You know, every tool is designed for a specific job, and the syringe pump is no different. Its advantages are obvious: insane accuracy, especially at super low flow rates, which is exactly what you need for potent drugs. But it has limits. It's not meant for delivering large amounts of fluid. You wouldn't use this to rehydrate someone. It's a specialist. Think of it as a surgeon's scalpel, not a sledgehammer. And you can see exactly where that kind of specialization is so important. From critical care units and cancer treatments to cutting-edge research labs, the syringe pump is just an essential piece of equipment anywhere that tiny volumes have to be delivered with absolute, unquestionable certainty. So, if you take away one single thing from all this, let it be this. A syringe pump is the ultimate tool for situations where the amount of medicine is tiny, but the need for accuracy is, well, it's everything. It's a device built on the idea that in critical care, every single microliter matters. To wrap it all up, the source material we've been looking at calls it simply a critical device in modern healthcare. And when you look at the elegant engineering inside, from its intelligent brain to its powerful brawn and that all-important safety net, it's really not hard to see why. It really makes you stop and think, doesn't it? This box, which looks so simple on the outside, is a true marvel of precision engineering. And it kind of leaves me with one last question for you. What other objects that you see every single day are hiding a whole world of incredible engineering just waiting to be discovered?